Dear colleagues, I'm going to present on corticosteroid responsive Parkinsonism. Parkinsonism is a constellation of common symptoms, which include resting tremor, rigidity, bradykinesia, postural instability, and many other symptoms, including fascination and hypomimia. And there are many classifications of Parkinsonism. And one of these classifications is as Parkinsonism can be degenerative and non-degenerative. Degenerative Parkinsonism includes disorders in which there is an accumulation or building up of substances. Alpha-synuclein is building up in neurons, as you can see on the picture on the right, and it is classically described in Parkinson's disease. It can also be seen in multiple system atrophy, and building up of tau protein is seen in many disorders, including progressive supranuclear palsy. And building up of TDP-43 in nervous tissue can be seen in frontotemporal lobar degeneration. And non-degenerative Parkinsonism include many disorders with different etiology. It can be vascular, toxic, drug-induced, infectious, and the most interesting today for my presentation is autoimmune etiology. People who respond to corticosteroids may be classified as corticosteroid responsive Parkinsonism. So this condition can include autoimmune disorders and also paraneoplastic disorders. This condition is not widely described now in the literature, and there are some reports. Some of them are presented on my slide, and I want to speak more about Sjogren's syndrome, systemic lupus erythematosus, Hashimoto encephalopathy, and people with positive antibodies to dopamine 2 receptor. But also I want to mention that steroid-responsive Parkinsonism can be seen in seronegative autoimmune encephalitis. It's a condition when autoimmune encephalitis is thought to be in a patient, but investigation of antibodies and infectious etiology is negative. Cerebral amyloid angiopathy-related inflammation is a condition in which there is an accumulation of beta amyloid, and also there are antibodies to this amyloid, and these cause inflammation. Also, corticosteroid responsive Parkinsonism is seen in patients with high antibodies to glutamic acid decarboxylase, antibodies to lysine-rich glioma inactivated protein 1, and in neoplastic condition with anti-MA2 associated encephalitis. And this condition is described in a patient with testicular cancer. Let's start with primary Sjogren's syndrome. As you can see on the slide, the most commonly seen neurological syndromes are headache, cognitive disorders, psychiatric disorders, and on the bottom of the slide, you can see Parkinsonism. So it's quite rare. Actually, I found one report about this condition. And in this report, patient had bradykinesia, rigidity, hypomimia, fascination, and this patient was started with classical Parkinsonism drugs like L-Dopa, carbidopa, amantadine, and there were no improvement on these medications. And then the patient was started on prednisolone, which resulted in clinical improvement and radiologic improvement in 1 month. As you can see on MRI on the right side of the slide, at the like you can see that there were lesions on above picture, and below you can see that these lesions are less hyperintensive after the treatment. Systemic lupus erythematosus. Mostly people with involvement of nervous tissue are presented with aseptic meningitis, headaches, seizure disorders, confusional state, and also there is a report of Parkinsonism. And the patient had bradyphrenia, bradykinesia, hypophonia, rigidity, abnormal gait, and this patient was started on prednisolone and cyclophosphamide. And this patient also had an improvement in clinical symptoms and on MRI. So what can we say about corticosteroid responsive Parkinsonism? It's not only the condition that is responsive for corticosteroid treatments, but also on other immunosuppressant drugs, suppressive drugs, and also intravenous immunoglobulins can be used in this condition. And if the patient shows an improvement, we can also call this condition as corticosteroid responsive Parkinsonism. Hashimoto encephalopathy. It has another name of steroid-responsive encephalopathy associated with autoimmune thyroiditis. So from this name, we know that this condition is responsive to corticosteroids, and also patients with this condition have thyroid problems, especially Hashimoto thyroiditis. And there are criteria which were created in 2016, and this criteria includes specific symptoms, thyroid disease, and brain MRI is usually normal. But as you can see on the slide, sometimes people with Hashimoto encephalopathy have lesions in the brain, as you can see here in the middle brain and in the area of putamen bilateral. Also, people have antibodies to thyroid peroxidase or thyroglobulin, and two other criteria includes exclusion of other disorders. So like there were no other antibodies to neuronal tissue in serum and cerebrospinal fluid. People with positive antibodies to dopamine 2 receptors, there are several reports of people with these antibodies in conditions like basal ganglia encephalitis, acute onset psychosis, Sydenham's chorea, chronic tic disorders, Tourette syndrome, and also there is a report of people with corticosteroid responsive Parkinsonism in patients with these antibodies. And the most important part of my presentation today is that there are antibodies to dopamine 1 receptor, which are described in Sydenham's chorea, Lyme disease, obsessive compulsive disorder, tics, but there were no reports about patients with Parkinsonism with positive antibodies to dopamine 1 receptor. And our next presentation is about a patient with this condition. So he had corticosteroid responsive Parkinsonism, and his antibodies to dopamine 1 receptor were positive. Thank you for your attention.
Okay.